From Riverside Health System, this is the Healthy You podcast, where we talk about a range of health-related topics focused on improving your physical and mental health. We chat with our providers, team members, patients, and caregivers to learn more about how to maintain a healthy lifestyle and improve overall physical and mental health. So let's dive in to learn more about becoming a healthier you. Hi, Dr. McQueen. How are you?
I'm doing fine. How about you?
I'm doing well. I'm really excited to have you join us today. Dr. McQueen is actually the Chief of Behavioral Health Services and Medical Director for Adolescent Services at Riverside Behavioral Health Hospital. Dr. McQueen, I want to talk to you a little bit about mental health and just for us to have a deeper discussion around adolescence and mental health and all of the things that have really come to the forefront over the last couple of years as it relates to behavioral health and some of the stigmas associated with behavioral health diagnoses. How does that sound?
It sounds good to me. I'm
All
ready.
right.
All
Dr.
right.
McQueen, talk to me a little bit briefly about, why you decided to pursue a career in psychiatry.
All right. So when I went to medical school, that's been a long time ago. But when I went to
Probably not
medical
as long
school,
as I went to nursing school, for sure.
it feels like it was a little while ago.
Hey,
I know when I
multiple
went to
decades.
medical school, we had to do, at least at MCV, we had to do, I think it was like 9 or 10 or so rotations our third year to see which ones we liked. And I kind of settled between either OBGYN and psychiatry. So I decided to go back and do another kind of a short rotation in psychiatry just to see how I liked it and just to be sure that that was what I wanted to do. And at that point, absolutely fell in love with it. Worked at their outpatient, well, not outpatient facility, it was an inpatient facility for adolescents. And at that point, just completely fell in love with it. Able to get the information out of kids, trying to figure out what it was that they needed to do to get themselves better, what it was that was making them feel the way that they were, and just trying to keep people from harming themselves or taking their own lives. It was something that was kind of powerful about it.
Absolutely.
And I decided to go into psychiatry at that point.
Okay.
Mhm.
What is mental health and what does it look like as it relates to adolescents compared
Mhm.
to our adult patient population?
Right. So mental health is a person's condition, kind of in regards to their psychological and emotional well-being.
Right.
In kids, it can look a little bit different because kids feel like they're going through things that adults or their parents haven't gone through before. So a lot of times, let's say that you and I got depressed and didn't want to go to work the next day. We didn't necessarily have to go to work the next day. We could call out, right? A lot of kids themselves, if their parents say, no, you can't sit in bed all day, you need to go to school, or you need to go to practice, or you need to get up and do your homework, then they generally have to do that stuff. So a lot of times for kids, mental health, if there's an issue with it, it'll show up as not only sadness, but it can show up as like irritability, agitation, becoming withdrawn, that kind of a thing.
Okay.
Mm-hmm.
So it sounds like people can be very functional, but still be dealing with mental health.
Right. Some people can be functional. Other people are made to be functional.
Right.
Now, just kind of depending on their surroundings and what's going on around them.
Right. I know I have a young person as well, and
Mm-hmm.
over the last 3 years, some of the major milestones occurred for him.
Mm-hmm.
Graduated from high school,
Right.
but the way those milestones looked changed due to
Mm-hmm.
the pandemic. So
Mm-hmm.
things were
Mm-hmm.
virtual, and I could see him really struggling from the social aspect.
Mm-hmm.
Some people need that connection,
Right.
and I know in my own personal life, I saw him struggle
Mm-hmm.
with depression
Mm-hmm.
as it relates to all of the things related to him changing so quickly.
Right. Here on our inpatient unit, the adolescent unit, we saw the same thing during the height of COVID. I honestly thought that we wouldn't have that many kids coming to the hospital, but we actually had quite a few. Our numbers really didn't go down that much, if at all, because those kids, like you're saying, missing that socialization, missing just being in school and being around other people. It was huge. And like you said, in those milestones, missing graduations and things like that, it was huge.
Absolutely.
Mhm.
Are there some other conditions that are more prevalent to adolescents? I talked a little bit about my son and depression, but are there others that come to mind as it relates to that patient population?
Yeah, a lot of the things that we see in the hospital, depression, of course, is big. We see a lot of anxiety in kids. We see panic attacks in kids. We also see what's called adjustment disorder, where there's a stressor that happens and the kid's just not able to adjust to that stressor. So we saw that a lot during COVID. We see that a lot now with kids sometimes having their cell phones taken away or maybe not doing well on a test or an assignment or something like that. So we do see that quite often. And we're also seeing some drug use in the hospital as well. So we have a few kids who have come into the hospital and they're using substances and sometimes either become more depressed because of it, or maybe even they're hearing and seeing things that other people don't see and hear because of drug use. Mhm.
Is there a, familial history or association or prevalence with addiction as well as mental health disorders?
Yeah, there is. There is. So a lot of times you'll see that there's a family member somewhere that has a mental health issue or a mental health condition similar to what the child has. Sometimes you'll see, mom or dad or sister or brother has depression. So that kid may have depression. Grandparents may have alcohol use disorder or maybe a substance use disorder, and we'll see those things trickle down into kids as well. So there is a genetic kind of what's called predisposition towards those issues. Mhm.
Great, great, great. What are some signs and symptoms of mental health issues in adolescence?
So one of the things that you can see is irritability. You can see agitation. Pay attention to sleep. If kids aren't sleeping well, sometimes that'll indicate depression, or if they're sleeping too much, that can indicate depression. Changes in interest. So if they're not wanting to hang out with friends, or don't want to do, or they don't want to do after school activities or participate in activities, if kids are talking about guilt, changes in energy, either increased energy or not enough energy. Sometimes you see changes in attention and concentration, changes in appetite. Sometimes you'll see kids and even adults too that just feel like they're dragging around more than they usually do. Or if they're talking about their arms, legs, or their head feels heavy. Other kids with anxiety disorders, sometimes you'll see them, they're talking about feeling shaky or like butterflies in their stomach, heart racing, changes in appetite, that kind of thing.
Okay. And
Mhm.
there's so much focus on body image.
Oh,
Are
yeah.
you seeing eating disorders, another issue in the adolescent population?
We do. We see that on occasion, anorexia, bulimia, sometimes just kind of unspecified eating disorder, but we do see that at times coming through the adolescent unit. Those sometimes can be difficult to treat, but medications can be helpful for some, and of course, psychotherapy can be helpful for just about everything.
We talked a little bit about this early on, but how do you feel COVID impacted the mental health and well-being of adolescents? You
Now,
know,
I think it was a little bit different. So you can look at it from both sides. So let's say that you had a kid who was in school, feeling like they were being bullied often. They had a lot of social anxiety around other kids or anxiety around test taking or being in school made them depressed. Some of those kids actually thrived when school closed because of COVID. So you saw that subset that was there. But most kids, like you said, they needed that socialization. School was their outlet. A lot of those kids didn't do as well because they weren't able to be around their friends. They weren't able to talk to their friends. They couldn't go over to their friends' houses as an outlet. So it did. It changed quite a bit. It seems like things are kind of going back to normal some now, but during COVID, things were different. For a lot of kids and a lot of adults.
great, great. That's great feedback. What should a parent do and or adolescent who needs help? What advice or direction would you give a parent to
But
support adolescents?
right. Well, the first thing that you want to do is that you want to talk to your kids. Always talk to them. Try to see what's going on. If your kids aren't talking to you, then one thing that you can do is kind of watch their behaviors, like we were talking about before. If they're isolating more, if you notice that the music that they're listening to is music that seems to be more sad, then sometimes that'll give you a hint. What parents should do is, of course, is reach out to a mental health professional. course, you could always come to Riverside. We could do an evaluation here to see if somebody needs to be admitted or not. And then if they don't, we can give resources to go outside in the community. You can also call any of the hotlines that can help with mental health as well. And of course, somebody else that you can reach out to is a pediatrician or a primary care provider. They can always kind of point you in the right direction.
All right.
Mm-hmm.
So just to add to something we touched on a little bit earlier, over the last couple of years, the stigma around mental health it still exists. And then
Mm-hmm.
definitely in certain ethnicities, it's more prominent
Mm-hmm.
around the stigma associated with behavioral health. Why is this important, and what should we do to continue to encourage and support within our communities to overcome this?
Mm-hmm. So I think stigma, like you're saying, is huge. I think one of the things that's helping to overcome the stigma, celebrities, athletes, they're talking about mental health concerns, mental health issues more in themselves. Even if they're not professional athletes, college athletes, younger athletes in high school, people are talking about it more. And that helps to break down that stigma. And once we can get that stigma broken down, then more people will be willing to reach out for help.
Very good. Very good. I'm sorry, go ahead.
Go ahead. Go ahead.
No,
I'm
no,
sorry.
no. I was just going to say, totally agree. Totally agree. Great feedback. Sounds like you were going to add a little something there. So,
You know, I'm getting old. I forgot what I was going to add now.
no, that is great feedback. Having those resources and the work in the community, and you're absolutely right. There's so much. Our young folks spend so much time on social media. I know my son.
Mhm.
When you talked about sleep patterns, I can't get a grasp for a sleep pattern. He
Right.
stays up all night on
Mhm.
social media or
Mhm.
games, and then he
Mhm.
sleeps all day.
Right.
But they're up,
Right.
constantly, right? They're
Right.
like night owls. But that's something that's good information to look for.
Well,
I think
one family told me that they did is, and they tried to set this up early with their kids when they first bought phones, kind of I guess, a behavioral modification technique. Every night at about 8 or 9 o'clock, they had a basket that they set out for cell phones and electronic devices. And at 8 o'clock, everybody turned their devices off, including the parents. So they turned their devices off and put them in the basket, and you couldn't get it again until the next morning at 6 o'clock. And the parents would take the basket and put it in their room. So
okay.
that actually helped the kids to sleep more at night. So some of that behavioral modification can help. And something else that can also help too is, instead of taking things away from kids or adolescents, if you take it away in the beginning, when they first get it, and let them earn time on it, that can be helpful as well. So that way they don't always have it, and then it seems like a punishment when you take it away. But if you let them earn time on it, it's like, all right, well, throughout the course of the day, you did these things that you were supposed to do. So you earn 2 hours on your iPad. So now you have that iPad for 2 hours. At the end of 2 hours, then when you take the iPad away, it's generally not as much of a fight as it would be if you just let them have it all the time and then take it away.
Absolutely.
Mhm.
Absolutely.
Mhm.
All right. I have really enjoyed our conversation. Is there anything else that you think you'd like to add as it relates to adolescence and mental health?
Mhm.
Uh,
Yeah. Just always talk to your kids, or if there's somebody else in the family who's willing to talk, because I know kids don't always want to talk to their parents. Sometimes they'll go to an aunt, a cousin, uncle, grandparents. Um, Sometimes even a family friend, they'll go talk to those folks. So if there's somebody that can talk to your kid, or you can talk to them, just be sure that they're doing okay. Ask them. Don't be afraid to ask them if they look like they're down or sad. Don't be afraid to ask them if they feel like they want to hurt themselves or take their own life. You're not going to give them that idea, but you're trying to save their life. So you want to see what they're thinking so that you can save their life. Um, so I think that's probably the biggest thing. Communication is the biggest thing. And then if they are talking to another family member or a family friend or something like that, not everything that a kid says, that that person that they're talking to isn't necessarily always going to come back and tell the parents. But if there's something where the kid's life is in danger, or something like that, then guardians need to know about that. So.
that's good information.
Mhm.
Sometimes I'll be in conversation and people will say, well, is mental health preventable? Is it avoidable?
Mhm.
What are your thoughts around that?
I think some things are avoidable in mental health. I don't think everything is avoidable. all those like psychiatric issues. Not everything is avoidable, because just like we talked about earlier, there's a genetic component. So there might be somebody in the family who has schizophrenia, and because that kid got those genes, we can't always avoid that kid getting schizophrenia. But depression, anxiety, some of those other things that can have a genetic component, if you're talking to your kids, not necessarily always allowing them to do what they want to do, because that's not the right thing to do, but talking to them and supporting your kids through issues that they're going through. If the depression or anxiety shows up, it doesn't have to be as bad as it could be, you know?
Right. This came up recently. Is all isolation bad? Some people need to isolate to
Mhm.
review, refresh, reflect.
Mhm.
What are your thoughts about that around that?
No, I don't think all isolation is bad. If somebody's had a stressful day and they want to go sit in their room for a couple hours, I think that's okay. I think when you need to be concerned about is when it's happening consistently, and I would say frequently, or all the time. So if you've got a child who's coming home and they're going to their room in the evening, and then they don't come out of their room for the whole evening, maybe they're playing video games or something like that, check on them, see what's going on. They're talking to friends. But if they're sitting there, they're sleeping, they're tearful, they're crying, that kind of a thing, you're just isolating more, and it's different from their baseline. It's different from what they normally do. That's when you should be concerned about it.
And there are certain medications, when you look at side effects,
Mhm.
that can cause depression.
Right, right.
But the benefit is so important that it outweighs some of the side effects. I know.
Right, it can be. I mean, and you even see that on TV with some of the medications that they advertise that aren't even for, mental health concerns.
Right.
They
Right.
tell you, well, if you're feeling more depressed or sad, like you want to hurt yourself during the commercial, let your doctor know. So
Right.
it can happen with any medication. So if you do feel that when you take a medicine, let your doctor know so that it can be changed. And just because one, let's say it is a medication for depression, just because one medication causes that, doesn't mean that the other ones will. You and I could both take Lexapro, and I feel like I'm more sad when I take Lexapro. Stop the Lexapro, switch me to Prozac, and then I feel fine.
Right.
That's usually a pretty rare side effect.
Okay.
Mhm.
Right. Very good. I can't think of anything else, but this was very educational for me, and I'm a
Mhm.
healthcare professional.
Mhm.
So I really appreciate your time, your knowledge, and your expertise. And thank you for your commitment and your team, all the great work that your team is doing over at Riverside Behavioral Health Hospital to
Well,
support
thank you.
our patients and the communities that we serve. Thank you for listening to this episode of Healthy You. We're so glad you were able to join us today and learn more about this topic. If you would like to explore more, go to riversideonline.com.